Human Metapneumovirus, HMPV, disease. Definition. Human Metapneumovirus, HMPV, is a single-stranded RNA virus from the Paramyxoviridae family, closely related to the Respiratory Syncytial Virus, RSV. It was first discovered in 2001. It causes acute respiratory tract infections, ARDS, ranging from mild cold-like symptoms to severe respiratory failure, particularly in vulnerable populations such as infants, elderly individuals, and those with weakened immune systems. HMPV primarily affects the respiratory system, but its clinical impact varies based on the individual's age, immunity, and comorbid conditions. Statistics and incidences. Globally, HMPV is among the top 3 causes of respiratory tract infections in children under 5 years old, along with RSV and influenza. It is responsible for approximately 10% of hospitalizations and 12 to 15% of emergency department visits for respiratory infections in children. 7% of acute respiratory hospitalizations in the elderly population. Outbreaks of HMPV tend to occur in late winter and early spring, often overlapping with RSV and influenza seasons. Classification. HMPV is classified into 2 main lineages, each with sublineages. Genotype A, subtypes A1 and A2, further divided into A2A and A2B. Genotype B, subtypes B1 and B2. Both genotypes circulate worldwide, with alternating dominance depending on the year, and show no significant difference in virulence. Causes. HMPV is caused by infection with the human Metapneumovirus, which spreads via droplet transmission, when an infected person coughs or sneezes, releasing virus-laden respiratory droplets. Fomites, contact with contaminated surfaces, example door handles, toys, and subsequent transfer to the nose or mouth. Close contact, prolonged exposure to infected individuals, especially in crowded environments like schools, daycare centers, or nursing homes. Risk factors for severe infection include age, 2 years or greater than 65 years. Underlying respiratory conditions, example asthma, chronic obstructive pulmonary disease. Immunosuppression, example cancer, organ transplant, HIV. Stages of HMPV disease. Incubation period, typically lasts 4 to 6 days after exposure. The virus replicates in the respiratory tract without symptoms. Prodromal phase, nonspecific, flu-like symptoms appear, including fever, nasal congestion, sore throat, and mild cough. Acute phase, symptoms peak, potentially including wheezing, shortness of breath, hypoxia, and signs of pneumonia. Severe cases may progress to respiratory failure. Recovery phase, symptoms gradually subside within 1 to 2 weeks, though coughing may persist longer. Severe cases may experience prolonged recovery due to complications. Pathophysiology. The virus targets ciliated epithelial cells in the upper and lower respiratory tract, leading to cell death, inflammation, and impaired mucociliary clearance. Inflammatory mediators and immune responses contribute to airway swelling, mucus production, and obstruction. Severe cases involve alveolar damage, resulting in bronchiolitis, pneumonia, or even acute respiratory distress syndrome, ARDS. In infants and young children, smaller airways exacerbate obstruction, while in elderly or immunocompromised patients, a delayed or overactive immune response worsens outcomes. Clinical manifestations. Symptoms of HMPV vary based on severity and patient age. Mild infections, common in healthy individuals. Low-grade fever. Runny nose, rhinorrhea. Cough and sore throat. Fatigue and mild headache. Moderate to severe infections. Wheezing and shortness of breath, dyspnea. Increased respiratory effort, retractions, nasal flaring. Cyanosis, bluish discoloration of lips and skin, due to oxygen deficiency. Crackles or rhonchi on chest auscultation, indicating lower airway involvement. Severe complications: pneumonia, high fever, productive cough, chest pain. Bronchiolitis, common in infants, with wheezing and rapid, shallow breathing. Exacerbation of asthma or COPD in patients with underlying conditions. Assessment and diagnostic findings. History and physical examination. Recent exposure to infected individuals. Signs of respiratory distress, such as retractions or grunting. Auscultation findings, wheezing, crackles, or diminished breath sounds. Laboratory tests. RT-PCR, gold standard, detects Hmpv RNA in nasopharyngeal swabs. Viral culture, requires specialized facilities but confirms infection. Serology, rarely used, measures specific antibodies. Imaging. Chest X-ray, may reveal patchy infiltrates, pneumonia, or hyperinflation, bronchiolitis. Differential diagnosis. RSV, influenza, parainfluenza, adenovirus infections, and bacterial pneumonia. Medical management. Hmpv lacks a specific antiviral therapy, so treatment focuses on supportive care. General measures. Rest and hydration. Fever control with antipyretics, example acetaminophen. Respiratory support. Oxygen therapy, for hypoxia, via nasal cannula or mask. Bronchodilators, to relieve wheezing, though efficacy varies. Severe cases. Mechanical ventilation, for respiratory failure. Antibiotics, if bacterial superinfection is suspected. Immunocompromised patients. Ribavirin, experimental, or intravenous immunoglobulins, IVIG, may be considered in select cases. Nursing management. Airway clearance. Use humidified air to loosen secretions. Perform gentle suctioning for infants with nasal obstruction. Monitoring. Check oxygen saturation and respiratory effort frequently. Observe for signs of deterioration, such as increasing cyanosis or lethargy. Parental education. Teach hand hygiene and infection prevention. Explain signs of worsening symptoms, example fast breathing, inability to drink. Psychological support. Provide reassurance to anxious patients and families. Complications. Respiratory failure, due to severe airway obstruction or ARDS. Secondary bacterial infections, otitis media, sinusitis, sepsis. Chronic respiratory issues, persistent wheezing or reactive airway disease. Home management. Prevention. Regular hand washing and disinfecting surfaces. Avoiding close contact with sick individuals. Symptom management. Encourage fluids to prevent dehydration. Use saline drops and suction for nasal congestion. When to seek medical help. Increased breathing difficulty. High fever unresponsive to medication. Signs of dehydration, example no urine output in 8 hours. Nursing management. Nurses play a crucial role in managing patients with Hmpv infection through both dependent and independent interventions, ensuring comprehensive care to restore health and prevent complications. Nursing assessment. Accurate assessment is critical for early identification and management of Hmpv infection. Assess respiratory symptoms. Observe for symptoms such as cough, nasal congestion, shortness of breath, wheezing, and fever. Report worsening respiratory distress or hypoxia promptly. Assess clinical manifestations. Identify signs such as tachypnea, fatigue, retractions, use of accessory muscles for breathing, and cyanosis in severe cases. Physical assessment. Monitor for abnormal breath sounds, example wheezing, crackles, oxygen saturation levels, changes in vital signs, tachycardia, fever, and the presence of nasal flaring or chest indrawing. Assessment in vulnerable populations. Pay special attention to infants, elderly patients, and immunocompromised individuals for atypical presentations such as lethargy, poor feeding, or exacerbation of comorbidities. Nursing diagnoses. Based on the assessment data, potential nursing diagnoses may include ineffective airway clearance related to excessive mucus production, impaired gas exchange related to alveolar capillary membrane inflammation, risk for fluid volume deficit related to fever and increased respiratory rate, activity intolerance related to impaired oxygenation and fatigue, anxiety related to dyspnea and hospitalization. Nursing care planning and goals. Establish care plans tailored to the patient's condition to achieve the following goals. Improve airway clearance and oxygenation. Prevent progression of respiratory distress and complications. Promote hydration and adequate nutrition. Reduce anxiety and provide psychological support. Educate patients and families on the disease process and preventive measures. Nursing priorities. Ensure effective respiratory function. Prevent secondary infections and complications. Support recovery and conserve energy. Provide education on management, prevention, and follow-up care. Nursing interventions. Nursing interventions should be evidence-based and patient-centered to achieve optimal outcomes. To improve airway clearance and oxygenation. Hydration. Ensure adequate fluid intake, 2 to 3 liters per day, to thin mucus and improve clearance. Humidification. Use humidifiers or nebulization to keep airways moist and reduce irritation. Positioning. Place the patient in a semi-Fowler's position to facilitate breathing and lung expansion. Suctioning. Perform gentle suctioning for infants or patients with severe mucus obstruction. Administer oxygen. Provide supplemental oxygen as prescribed to maintain adequate oxygen saturation, 92%. To conserve energy and promote rest. Minimize overexertion, encourage rest and limit physical activity during the acute phase of illness. Promote comfortable positioning, regularly reposition the patient to enhance lung ventilation and reduce fatigue. To promote hydration and nutrition. Encourage oral fluids. Offer small, frequent sips of water or electrolyte-rich fluids to prevent dehydration. Nutritional support. Provide nutrient-dense, easy-to-digest meals or supplements to maintain energy levels. To prevent complications. Monitor for secondary infections. Watch for signs of bacterial superinfection, example persistent fever, worsening cough. Vaccination. Advocate for seasonal vaccinations, example influenza, pneumococcal, to reduce the risk of co-infections. To educate and support patients. Patient and family education. Explain the nature of Hmpv, common symptoms, and the expected course of illness. Preventive measures. Teach proper hand hygiene, respiratory etiquette, and avoidance of crowded areas to reduce transmission. Follow-up care. Advise follow-up with a healthcare provider to monitor recovery and detect lingering complications. Evaluation. Evaluate the effectiveness of nursing interventions based on the following outcomes. Demonstrates improved airway patency and oxygenation. Maintains adequate hydration and nutritional intake. Shows reduced fatigue and returns to normal activity gradually. Complies with preventive measures and follow-up care. Experiences no significant complications such as bacterial superinfection or respiratory failure. Special considerations for vulnerable groups. Infants and children. Monitor for apnea, difficulty feeding, and irritability. Provide comfort measures and family education. Elderly and immunocompromised patients. Assess for atypical symptoms such as confusion or worsening of pre-existing conditions.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.